Well, hello, ladies and gentlemen. It is such a pleasure to be with you today. I'm David Armstrong. I am a professor of surgery at the Keck School of Medicine of beautiful University of Southern California. I'm also the co-director of the Limb Preservation Program and the founder of our Southwestern Academic Limb Salvage Alliance, or SALSA. I was one of the four main authors who developed the recent guidance document, along with three of my really good friends, the first being Professor Joseph Mills, who's professor in chief in the Division of Vascular and Endovascular Therapy at the Michael DeBakey Department of Surgery at Baylor College of Medicine. The second was the pride of Wake Forest, Joe Molnar, who's professor of plastic and reconstructive surgery and director of the burn unit. The fourth of these partners here, including me, is Ms. Maritza Molina, who's an outpatient clinical dietitian at Keck Medical Center of USC in our Department of Surgery. And she's just spectacular and a real favorite with our patients in our clinic. This was brought to you by the American Limb Preservation Society, or ALPS. ALPS is a not-for-profit medical specialty organization with its mission to completely eliminate preventable amputations over the next generation. And I don't think you can do that without good quality nutrition, which is one of the big unmet needs that we've had. And it was also done with developmental and dissemination support from Guideline Central, which partners with more than 40 medical societies to create these sorts of documents, which I think are terrific. And you can access them at guidelinecentral.com in the mobile app for iOS or Android devices, or just online. The scope of the guidance covers assessment and screening, nutrient goals, when to intervene, choosing the appropriate interventions, patient information, adherence, and so much more. It's free of charge. I invite you to check it out at guidelinecentral.com/DFU. That's guidelinecentral.com/DFU. That's for diabetic foot ulcer. We developed it because we recognized that there's really no other credible guidance right now that cover this important topic, remarkably, nutrition and diabetic foot ulcers. Why? While there are current international pressure injury guidance documents that give some information, those are for pressure injury and not for diabetic foot ulcers. And we understand that we wanted to add detail to that area and sort of try to fill, or at least to begin to fill, this really big unmet need. So how to use this whole thing? First and foremost, the guidance was developed as a quick reference tool, not some massive tome that you're never going to open. The recommendations are bulleted and concise, so they can be referenced at a point of care. It also makes, I think, a great teaching tool, at least for me as one of the authors, and as a starting point for a discussion when creating or reassessing formalized institutional protocols. In this topic, there are a number of quality indicators that can help address and promote institutional change. These include structural, process, and outcome quality indicators. There'll be a full list of these indicators in figure 3. And in terms of language guidance, how clinicians talk to and communicate about people with diabetes plays an important role in that engagement and really in psychosocial well-being. And just a quick tip, person-first, strengths-based, empowering language can improve communication and enhance motivation, health, and the well-being of people with diabetes. And really, if we want to talk about real calls to action, it's this. I just want to tell you, thank you for reviewing this overview segment. We hope you continue on to view the next segment. It's going to star the extraordinarily talented Maritza Molina. You can visit the full guidance document at guidelinecentral.com/DFU. You can visit other resources on the ALPS website. And thanks a million. Here's to making a difference.